want to say good evening, and again, I want to thank you for the opportunity to come and represent and talk about community and the effect of the closing of the hospital, what their thoughts are, the impact, and also recommendations. You might ask the question, okay, what part of the community are you talking about? Well, I think you already heard I come as a past high school principal, retired pastor, and also in the community, I'm going to say a bartender. I no longer have that occupation, but again, I come from a number of perspectives. I serve on a number of boards, and I do my best to try to stay close to the concerns of the community. Yes, there's a great impact when you talk about the closing of a hospital. And I want to thank my colleagues for your perspectives. The big thought or takeaway today is mental health, which is a big issue. In many of the committees that I'm working on, it is a major concern, and we're struggling and also pushing real hard to try to make partnerships with many stakeholders and sectors of the community addressing the same problem. But you know, there are also other challenges that were in place even before the closing of the hospital. How about comorbidities such as diabetes, high blood pressure, and cancer? One of the concerns as a community member is some of the health disparities that exist in Coatesville and vicinity, that those challenges will be exacerbated. And that's pretty sad. And then the question is, what responsibility do we have in trying to address them? Well, you know, it takes an entire village to raise a child. It will take each and every one of us working together. Every aspect, every person that you see here, every person in this room, and every person on the internet looking at this, and every person on, I'm going to say 919 North Walnut Street. I just picked that out. Not picking anybody. That's where I used to live in Valley Township to solve this problem. There's a great impact. You think about the closing of a hospital, jobs. In the United States, 1 out of 9 jobs are dedicated to health care. Think about the persons who no longer work at Tower Health or no longer work at Jennersville. That's the impact. The hospital, community hospital, plays a major role in a neighborhood, in a community. A couple things. First of all, it builds community wealth. We have jobs. People have an opportunity to get a job, and hopefully with insurance, which is not so true in many cases. There are many employees, persons working in hospitals that still don't have adequate insurance. And when you look at some of the numbers and look across Pennsylvania, the Commonwealth, there are 3.3 million persons who are on Medicaid. That's about 1/4 of the population on Medicaid. And when you consider what will probably happen at the end of this, well, the pandemic, we're still in it. What's going to happen to those individuals? We have closings of hospitals, and then we're going to have additional persons without health care. When we talk about the role of a hospital and the impact, hospitals, they develop community partnerships. Think about some of the great programs that Tower Health and Brandywine used to run. Information on addressing health, I'm going to say addressing eating disorders, or addressing, in some cases, food insecurities or high blood pressure. Okay, that's gone. That's the impact. That's the role that the hospital plays, and now those areas are gone. We talk about access to the hospital. Of course, has already been mentioned. Transportation, the closest hospital, I think, is 30 to 60 minutes away. We're talking Chester County, depending on where you live, within the Coatesville area or within the Jennersville area. So a hospital in the community, it actually improves healthcare access. Without it, I think you already have the picture. It also builds something called social capital. I mentioned that before. Think about everyone coming together. Robert Putman, who is the author of Social Capital, but really it comes from the old African proverb, it takes an entire village to work together to raise a child. And when you think about those issues of social capital, people coming together, there's already research that expresses that those communities that were together that had health care, there were fewer incidents of COVID-19, fewer deaths in those communities. Now again, we have 2 hospitals missing. And also the hospital, the impact of a hospital is the leader in addressing diseases most afflicting the community and vulnerable populations. We can't forget about the vulnerable populations. That's the impact. Now, how about the community response of closing? As I had an opportunity to have conversation, and I want you to look at your neighbor and say, I'm part of the community. Go ahead and say that. Right, there we go. I'm part of the community. We're all part of the community. You know, they're just different conversations and emotions and anxiety. In one of the committees, organizations I'm involved with, one of the grandmothers said, what am I going to do with my grandson who's experiencing mental health issues? Where do I go? And there was almost an immediate panic when she asked the question, which led at least to one group, which is the NAACP, to begin to lift that as one of the major areas to address in the city of Coatesville and figure out how we can partner with other organizations. Another question is, where do I get screenings, routine tests, x-rays? What about the transportation barriers? There's also community grief. We haven't discussed that. Of course, there's loss of income, loss of job, but how about volunteers who've worked through the years? Think about, my mother, father, and sister all passed away within 30 months, over a 2-year span, if you can do the math, how that works. You know, so there's memories. Not that that's something that you want to think about, but there's a loss. Hospitals are institutions that bring people together. And also, we considered a community response of closing. I already said this. What are the diseases most afflicting my community and vulnerable populations? Another community response to COVID-19 and vaccines and emergency services already mentioned. And the last piece I'd like to talk about are recommendations and considerations in meeting the gap of services. I have 7. The first one I have here, Community Health Report Card. I think now is a great time to get a report card on the health status of Coatesville and vicinity, and not just Coatesville, but also in southern Chester County. When we talk about addressing the challenges, we can't really address the challenges until we really know what we're dealing with. Much of that information we can get from Chester County Department of Health, and we can get also from Pennsylvania Department of Health. We need to determine what are the health disparities and health equities, and the closing, which again exacerbates health challenges. Seniors, when we talk about vulnerable communities, we're not just talking about people of color, we're talking about women, we're talking about seniors, and many persons who are in other health challenging situations. We need to establish larger partnerships. We can no longer having a partnership I think is excellent, but the problem is bigger than an institution. The problem is bigger than actually any one of us. It's bigger than a name. The only way we're going to solve the closing and also trying to fill in the gap, we all have to come together and increase the circle, so to speak, in addressing the challenges, trying to be as best as possible on the same page. Still have your identity of the organization, retain that, but also come together to address the challenges. Work through existing health alliances to address health equity and advocacy. And this is a great organization, in which, and I want to thank you again, Vanessa, and all the staff for putting this together. We must use trusted voices in the community. I did a research in 2019, and it's not about the research, what it's about Coatesville. Think about it. There's now mistrust. When the new individuals come in, there's going to be some mistrust. And how can we develop and increase trust? We have to give the organizations maybe some directions. And one direction, whenever a new vendor comes into town, or where we are now when our residents go to other hospitals, one thought it would be great to have those hospitals, the faces and the voices, actually in the community. Maybe not necessarily in that bar that I used to run, but how about in the barber shop? How about with some of the other organizations? other groups that you may not see in this meeting. Also, we need to determine a community site and location for routine health information, COVID-19, vaccines, and et cetera, to address many of the health disparities, to address many of the comorbidities that our residents are facing and experiencing. So I think that's about enough.